of what I'm going to talk about, if that's helpful afterwards. So I wasn't able to put slides or a presentation together. So I'm going to just talk through a few things that are on our radar. Just a little bit of background about maybe who we are. I know some of you on this call, but not everyone. So the Montana Budget and Policy Center is a nonpartisan, nonprofit research organization. We're based in Helena. We focus on tax and budget policies and look at how those policies impact low and moderate income families in Montana. We are also just recently have taken over Kids Count in Montana. And so that previously resided with the University of Montana Bureau of Business and Economic Research. We now are the Kids Count grantee for the state of Montana. And so some of you may have had the chance to meet my colleague, Xana Berg. She is our Kids Count coordinator, has been with MBPC for the past year. And so I'm not going to touch on all of the issues that probably you all are focused on. We are a member of the Montana Advocates for Children. And so I hope that you all have been getting updates from MAC as well. So I thought I would just kind of focus my talk on a couple big items that we're going to see over the next week or so. So again, a big piece of what we track is the state budget. The state budget process really starts in subcommittees where they dig into the different agency budgets. The subcommittee that has jurisdiction over the Department of Public Health and Human Services focuses their entire time on DPHHS. It's the largest agency in the state, and that subcommittee has just that one agency. So they have been spending the last several weeks talking through the various divisions of DPHHS. And actually later this week, they will be holding the hearing on the new division, the Early Childhood and Family Support Division. So that hearing is taking place on Thursday of this week. So if you, I would certainly encourage you to listen in on that hearing. They will take public comment during that process on Thursday as well. And so I know that the Montana Advocates for Children is coordinating some testimony about the programs that reside within that new division. So I was going to I'll throw in here, I've got, like, as you can imagine, about 400 tabs open on my computer. So let me just throw in the chat. And again, I'll send an email with these. So if you don't want to pull them all up right now, I'll send an email out to your folks after. This is the Legislative Fiscal Division's report on this division's budget. So I feel like this is probably, there's a ton of information on the legislative website on the budget, but this is the one piece that's really specific to this division. And so it may be a helpful resource for you all. So we'll see how that hearing goes. The subcommittee is not scheduled to take action on any of the DPHHS budget until the following week. So they'll start executive action. Right now it's scheduled for the 17th. So I think we'll have a better handle on what we could expect out of this subcommittee at that point. So I do think, I know that this group is quite focused on probably the appropriation side with DPHHS and investments in early childhood education. There is one revenue tax bill that I also wanted to flag for folks that's coming up later this week. It is also on Thursday. There is a bill that is proposing to essentially trigger automatic income tax cuts when the state sees revenue levels in excess of a certain amount or growth in above certain levels. This type of legislation has passed in other states. We're very concerned about what this might mean for investments in the future. So that bill is Senate Bill 182. It will be heard by Senate Tax Committee on Thursday, and I think there will be a number of folks there to oppose, really with the message of, Montana really needs to continue to invest more in certain areas. I think early childhood education is one of those. I'm sure that many of you have been part of these conversations over the last several sessions. Montana really remains one of only a handful of states that doesn't invest state resources into early childhood education in a way that it should. And so if we're thinking about the long-term viability of increased investments, triggering automatic income tax cuts will have a significant impact on our revenue levels moving forward. And I think the ability for the legislature to invest in those types of things in the future. So this is a bill that we're flagging for groups that may not necessarily be focused on tax policy. But if there are organizations that are interested in learning more about the structure of this bill, we'd be happy to stay in touch with you. I think we're encouraging folks to come in to oppose this measure and really just elevate the need for increased investments in the future. So a couple other bills that I want to just highlight for folks. We also have worked over the years on expanding access to affordable healthcare coverage. Certainly Healthy Montana Kids is an important program for the families that you all serve, as well as Medicaid expansion. There is a bill, Senate Bill 100, which is named the Welfare Fraud Prevention Act. It is based off of model legislation by a fairly conservative organization that would essentially beef up the eligibility determination process for those who are accessing Medicaid coverage, CHIP coverage, and food assistance through SNAP. This bill has us very concerned about what it might mean for healthcare coverage for children and adults in Montana. Montana has continuous eligibility for children through the Healthy Montana Kids program and for adults through the Medicaid expansion program, which allows someone, if they're eligible, to access coverage for a full year. This bill would essentially end continuous eligibility and would require verification of eligibility on a quarterly basis. So the department does project a pretty significant loss of coverage for both children and adults through these programs. We know that many folks become their income fluctuates over the year. And so continuous eligibility has been a really important component of these programs to maintain continuity of coverage. It reduces the churn on these programs, and this would essentially eliminate continuous eligibility. They estimate that this, right now, the fiscal note projects that the Department of Public Health and Human Services would have to add 40 new FTE in order to just determine eligibility and re-enroll folks who may lose eligibility and then become eligible later in the year. So it's a huge administrative burden and would also result in the loss of coverage for many, many families across the state. And then the one final thing, because I want to leave on like a positive, one bill on a positive note. So there is a bill again this legislative session to propose a family medical leave insurance program for the state. This legislation, it's House Bill 228, and it is modeled off of successful legislation that we've seen in other states. Today, there are 9 states that have established a statewide family and medical leave insurance program, and this is modeled after those programs. It would essentially create an insurance fund that workers could tap into when they need to care for a loved one that may have a serious medical condition, welcoming a new child into the family, or to care for themselves if they are facing a serious medical condition. The fund is covered through modest contributions by employers and employees into the fund. So it works similar to unemployment insurance. And then workers can then access a portion of their wages through the fund during these types of situations. So it's been a successful program. Washington, Colorado, and Oregon all just more recently adopted programs. California has had theirs in place for over 20 years now. So that bill is also up for a hearing this week. Senate Bill 228 will have a hearing on Wednesday, and I think we'll have a number of folks that will be there in support of that bill to talk about the importance of accessing paid family leave for families, for workers, and for businesses as well. So those were kind of the main things that I wanted to highlight, but I'm definitely happy to answer if there are questions or other items that are on folks' radar. It's going to be a very chaotic, busy week, I think, for many of us. There's a lot going on and a lot kind of hitting hearings in the next week or two. So happy to answer questions, or if folks have other things they wanted to add.
So the current eligibility for the health plan is a year. They renew every year, and this bill is asking to go down quarterly.
Yeah, essentially. So Montana has had continuous eligibility in place for Healthy Montana Kids for quite some time, and then they added continuous eligibility for Medicaid expansion in 2015, which essentially, once you become eligible and you enroll, you are eligible for a full year right now. And I will say that bill has had a hearing, Senate Bill 100. That hearing took place in Senate Public Health. We are hearing that it will probably pass through that committee and may make its way over to the House. So I think that's one just to keep on your radar. If it does move to the House, there will be another hearing on it. And I think it is important for folks to be elevating just how critical Healthy Montana Kids and healthcare coverage is for families in Montana.
What, if anything, are you hearing about the new department? Are you hearing that they're going to cut it, keep it? Are you hearing anything?
That is a great question. So I thought I do find it interesting. They are the last division to have a hearing. There hasn't, to my knowledge, there hasn't been a lot of conversation at this point about the division. I think that the Montana Advocates for Children are emphasizing the importance of establishing this new division and really being able to have a space where you're really focused on young children and the various programs that reach young children. But beyond that, I haven't heard if they're looking to, dismantle it or adjust it from what, the previous administration has proposed.
And what are you hearing, if you can answer, about the overall DPHHS budget? I know that the governor mentioned going back to 2019 numbers, and is he still holding with that? Is that what we're still looking at, or?
Yeah, so the Governor Gianforte's budget for DPHHS was, there are definitely some differences from what Governor Bullock had proposed, but largely in line with what Bullock had for DPHHS budget. He maintained most of the really critical present law adjustments in the Medicaid programs. It's actually been the subcommittee that started their action on the DPHHS budget by moving the base down. So all of the other subcommittees are starting their budget process with looking at 2021 appropriated as the base, and then they build from there. That's a fairly traditional process of where to start the budget process. The subcommittee for DPHHS took action right at the start of their process to move DPHHS budget down to the 2019 actual spend. That has the effect of reducing their budget by about $500,000 per year. So if you think about over the 2-year biennium, it is about $960 million reduction in their budget. What is unclear to us at this point is how they plan to take action from here. So if they're going to build from that 2019 and adjust back up, or start, basically take action from that 2021 base. It is not been made clear. And I think that many advocates are concerned. And there's just a level of uncertainty about what the subcommittee is going to do at this point. I think we're assuming that they will build back up to the 2021. I think then the question is, are they going to take the adjustments, into the next biennium that are really critical? I mean, those are the adjustments that really just maintain existing services into the next biennium. So I think there's just a lot of uncertainty right now.
Thank you, Heather. Any other questions or thoughts from folks? Now's your chance. Don't be quiet. Okay, I guess we're good. Thank you so much for coming, Heather. You're welcome to stay if you like, but I know this is super busy time, so if you need to jump off, we understand that too. I appreciate the update. I do follow the early childhood, more specific bills, but I lose track on some of these bigger budget bills because it's too overwhelming. So it's always good to get that quick update and go from there. So thank you very much.
Yeah, absolutely.
Thank you, Heather.
I'll send an email with some of these links, and thank you for having me. I really appreciate it.
Yes, we appreciate you coming. Thank you so much.
Okay, take care.
Thanks. So we actually have just a couple minutes left, and so I want to jump in on this featured focus piece, and just remind everybody that we are still waiting for executive action on SB 142, which is the child care ratio bill, to increase child care ratios in family and group homes, and then change the distinction between a group home and a center. And then we had another bill come across today. I gotta find the number. Oh, HB 327 is on HOAs. And the wording of the bill would make it really hard for family and group homes to operate under a homeowners association because they would be a business. So those are kind of the bills we're watching right now on the childcare level. I don't know if there's any more that I'm missing that somebody else maybe has information on, or. Quiet group today, guys. Jeez. Okay, well, then we will jump back into the agenda, and we'll do task force updates. So maternal mental health. Who can, there you are, Kelsey.
Hey, yes, I will just give a quick update on the maternal mental health task force. So as of last week, we now have, the task force has been helping support getting some people trained in our community to run virtual group peer supports for parents, and kind of the primary focus is the postpartum timeframe. So we now have 5 people trained and are looking at the next steps of those people getting their groups started, and kind of what populations and what their focus is. So when I have more information, I can certainly share. We're also looking at getting them all set up on Connect, so that referrals can be sent through Connect to those group leaders. So that's exciting, and hopefully in the next couple of months we'll have some up and running so that our parents can get some more support and just more peer-to-peer support, because that's helpful during this time frame. And then we are still continuing on with our guide. So a guide that would go out to the community, also have an online platform as well on just how to, if somebody is really needing help in the postpartum time frame, who best to refer those women and families to. So we're continuing down that road. We're still kind of looking at like how to vet the guide, and what types of like how many CEUs and what types of training providers it would be recommended for providers to have to be able to be in the guide, and just have a understanding of the postpartum population. And just kind of also collaborating forward and kind of looking at avenues on help with publishing and funding as well with it. And I believe those are our kind of top 2 things going on right now.
Awesome, thank you so much. Jamie jumped off. Is there somebody else that can do home visiting task force? I shouldn't have let her leave. Okay, well, I will make sure we get the home visiting task force update in the notes that get sent out. So Jeff, I think you're up for early care and education.
Right. Early care and education is, well, I think, I think Brandy, you had a great suggestion, and I'm not suggesting we're totally on pause. Megan is working on some great projects with the community cafe groups and engaging some parents. And that is important work that needs to continue. And I am willing to do any work needed as we transition. But my role is also transitioned. And I know that, you all are working through your relationship with Headwaters and figuring that out. So while there is good work to be done, I can say that in my new role at the United Way, we are doing with 3rd through 5th graders, we are doing a art project for the community. That's going on. But beyond that, in terms of some of the goals and tasks that we set for the year, we're at a little bit of a standstill. So, yeah, and I would just say, Kelsey and the team with maternal mental health, you guys are doing great things. Keep up the good work. Happy to help there however I can. But yeah, that's it for a report right now. Not a lot going on. We're still looking at membership and co-leaders and a replacement for my role.
I'll take it now tomorrow, Karen.
So yeah, that's what's going on.
Perfect. And the early care and education task force, I do think we're kind of in a limbo state. The task force was melded with our Helena 0 to 5, and that's all kind of up in the air right now. So it kind of got, put on pause. So that's a great update, and we'll keep everybody posted, but we are definitely looking at recruiting members and possibly rewriting our strategic plan, or just relooking at that for this particular task force, because our plan is pretty good. We just have to build it up. So thank you, Jeff. Okay, well, we might be done early at the end of day meeting here. Any announcements anybody would like to make from agencies? I never should have said we'd be done early, because now nobody's going to talk to me.
I have an announcement to make from St. Peter's Health. So we have launched our new Taking Care of You program, and so that encompasses supports for women and parents in the pregnancy and postpartum timeframe. And our program is really aimed at identifying early identification and support for substance use, mental health, social determinants of health, stressors in people's lives, and just really trying to support parents and hopefully have better outcomes for the next generation. Our population is pregnancy through 1 year, postpartum is our goal population, but our team, there's myself and one other nurse that's working with this population, as well as we have 2 social workers and 4 behavioral health professionals or therapists that are working on our team as well. I do have more of a formal presentation that I do give to different organizations that are interested. So if that's an interest, I'm happy to do that at a future meeting.
Definitely, thank you. Jeff, you unmuted. Do you have something from United Way?
Just results of our point in time survey across the county. We counted last Thursday, we counted 96 homeless folks in our unsheltered count. I have not got the results from our sheltered folks. There's usually those numbers are between 200 and 300 that are sheltered across the county. But in terms of folks that are unsheltered, and we got reports from Lincoln, Wolf Point, not in the county, but also Townsend and Boulder. Yeah, 96 folks that are out there homeless. And that's up considerably from last year. Last year's number was 57. So I don't know if it's COVID or what it is, but anyway, that's just a little slice of Helena, Montana. So.
And by unsheltered, that does not include like the couch surfers and things like that, right? Those would be.
That's right.
Sheltered?
That's right. And also, okay. The school district is also submitting, and that's where you get a lot of those homes that are doubled up, things like that, because the school district has a different standard of homelessness than the Housing and Urban Development and the HUD survey. The HUD survey is people living in places that aren't meant for habitation, whereas McKinney-Vento refers to folks that are doubled up, multiple families living together. So, and I don't have all those school numbers yet, but initial count from the school district was between 100 and 150 students in doubled up situations. So, yeah, interesting.
Wow. Okay.
Yeah.
Well, thank you for that depressing news, Jeff.
Thank you for that good news. Yeah.
When you say those numbers, I just instantly think of how cold it is right now outside, and it breaks my heart.
Well, and I realize that one of the reasons they do this survey in January is the assumption is that most folks will be sheltered, and the bulk of the folks are sheltered, and they really try hard not to overlap, and that's why it's called point in time, because when our group went out on the evening of the 28th, we were specifically looking for folks that are unsheltered. Now, understand, For example, I went to a couple of our campgrounds, and there are some very nice campers that are obviously sheltered there for the winter. But there were some that were not very good shelters, and I mean, and we counted those because they're far from permanent. So anyway, and also, the numbers may also have been up a little bit because of it was an observational survey. You just had to make a judgment based on what you saw, where in the past they were actual, it was a 3-page interview. And so a lot of people would refuse to do that interview, so that could be another reason why we had a higher number. It was just the nature of the interview or the nature of the survey. So anyway.
Makes sense. Well, thank you, Jeff.
Sure.
I'll give a quick update. Child Care Connections, we are starting into our coloring contest. This will be our 2nd year. We did it last year, and of course, right at the end, COVID hit, and so we kind of shuffled a little bit, but we are going to run our coloring contest again. And when I say coloring contest, the artwork is going to be very open-ended, so it'll be developmentally appropriate for the age groups. I'll probably be reaching out to several of your organizations to see if you can, give out coloring sheets, things like that. We're kind of taking a new approach. I don't know exactly what our sheets will look like, but we're thinking something like a picture of a couch, and then like, this is what my family looks like. And so the child would draw in their family or something like that. So I will be in touch with that. We do ask for sponsors for our coloring contest because we do give prizes and recognition. So that information will be coming out soon. Child Care Connections is also taking over fiscal agent for the ECC. Mainly, not that we love the county health department was doing great. They're a little overwhelmed right now, and it's a little bit more difficult because you have to, when you get money and things in, it goes through a larger process, being that it's the county. So Child Care Connections is going to begin acting as the ECC fiscal agent. We're working out all the fine details of that coming up. Larissa, am I missing anything? I'm putting her on the spot. She's like, no, why are you calling on me?
I don't think so. I think you covered it all.
Okay. I mentioned earlier the bills we're monitoring, keeping an eye on. There are immunization bills that we know are coming down the line for immunization regulations or stopping of regulations in childcare. So those are coming out as well. We don't know exactly when. I think that's all I have. Any other updates or questions of the group? Geez, you think it was Friday at 4:41, not a Monday. The day that Megan has me facilitate, you guys are all quiet.
What can I say? My Chiefs lost yesterday. It was a tough day.
It was a tough day. Not that I'm a diehard Packers fan, but I was going for the Chiefs.
Yeah, I thought they just didn't look so good.
No, it was a sad day.
That's all right.
But, all right, well, I'm gonna adjourn us just over 15 minutes early. So thanks, guys, everybody. Megan will get these notes out soon. That's why I recorded this, so I didn't have to take notes. So thanks, guys.
Thank you.
Thank you.
Have a good week. Stay warm.